Good morning, everyone. My name is Pam Sveinson, and my pronouns are she, her. I'm here today in my role as Executive Director of Manitoba's Integrated Youth Services, or IYS initiative. It's a pleasure to welcome everyone here today, including those joining us online, to this morning's announcement and also to this very special place that youth know as Huddle South Central. This space is one of 6 Huddle Integrated Youth Services hubs in Manitoba. It's important to start our time together in a good way by acknowledging that Huddle Youth Hub sites are located on Treaty 1 and Treaty 2 territories. These lands are the traditional territories of the Anishinaabe, Cree, Anisinu, Assiniboine, Dakota, and Dene peoples, and birthplace of the Red River Métis. The water we drink today comes from Treaty 3 territory of Shoal Lake 40 First Nation, and our electricity comes from Treaty 5 territory. At Huddle, youth will find free, low barrier, and culturally safe health and wellness support, and service providers who welcome them as they are. Supporting the health and wellness of youth in our country is of the utmost importance. By expanding our understanding of health and wellness and addressing the intersecting needs of young people, we can help them and support them to live healthy and fulfilling lives. To do that, we must listen to the lived and living experience of youth. We must reduce barriers to accessing the full continuum of care and support our youth in navigating systems that are often complex and difficult. With that, it is my pleasure to call upon our MC for today's event, Member of Parliament Terry Duguid. Mr. Duguid is currently Parliamentary Secretary to the Prime Minister and Special Advisor for Water. Welcome.
Well, thank you, Pam, for that warm welcome to this beautiful space. It's great to be with you and the Huddle team, and thank you also for the land acknowledgement. Folks, as Pam mentioned, my name is Terry Duguid, and I am the Member of Parliament for Winnipeg South. I'm joined by the Honourable Mark Holland, our Minister of Health, and the Honourable Dan Vandal, Minister of Northern Affairs, Prairies Can and Can-Nor. And we're so pleased to be with you today for this important announcement, which will help provide our children, our youth, and people living with a disability better access to essential oral health care. I'd also like to extend a big thanks again to the Huddle team, Pam, Tony, and the rest of your phenomenal team for hosting us today in this beautiful space. We appreciate your tireless commitment to providing healthcare and support for youth in our community. Just before we begin, I'd like to note that there will be an opportunity for media to ask questions following the announcement in either official language. And now it is my great honor to introduce you to the Honourable Mark Holland, Minister of Health. Mark was first elected as the Member of Parliament for Ajax in 2004. As a Member of Parliament, Minister Holland has served as Leader of the Government in the House of Commons, as Chief Government Whip, and as Parliamentary Secretary to the Minister of Public Safety and Emergency Preparedness. He has been a staunch advocate of marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. In both public and private roles, Minister Holland has backed health-related initiatives. He has served as Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth. So please join me in welcoming my friend, my colleague, the Honourable Mark Holland. Mark.
Merci Terry, c'est un grand plaisir d'être ici avec vous pour une annonce vraiment absolument essentielle, je pense, pour notre pays. Le plus grande amélioration pour notre système de santé dans l'histoire de notre pays. You know, so to be here in Saint Boniface with Dan, who's such an incredible advocate for youth in this country on such an important day, and Terry, who plays such an important role nationally, in leading our charge on really everything, because you've got to look at the whole picture as you develop the national plan of what's next. But now we're talking about what's today. And I want to thank Pam because here at the Huddle, the Center for Integrated Health Services, what you do every day to see vulnerable people and help them navigate, as you were saying, what is often very complex and situations where they don't know how to access the care they need. Pam was talking to me about folks coming in pain who don't even realize they're in pain. And we're talking here about their oral health, kids coming in who've really had pain so long in their mouth that they think it's normal. And imagine when they finally are able to get care. And that's what we're talking about today. But a lot of times we talk in, sort of high level and abstracts about what we're trying to do in oral health. Pierre Poilievre said that the dental care plan didn't exist. Well, for a plan that didn't exist, in 6 weeks, 200,000 people have gotten care. Almost 11,500 providers, representing about 40% of providers across the country, are participating. Almost all hygienists, almost all denturists are participating. And when we talk about those 200,000 people, before we make this announcement, I think it's time to just take a moment and think about who they are. I was talking to 2 days ago in Windsor, Navjeet. Navjeet runs a mobile clinic. She calls it the Smile Wagon. And she goes and she visits folks. And she was meeting one of her patients who hadn't been able to get dentures in her mouth. And when found out she was going to be able to get dentures, said she finally was going to arrange family photos because she was proud of her smile. That she put off a job interview because the idea of having teeth in her mouth when she went into that interview was everything for her sense of dignity and for her sense of confidence. To be, even more direct about it, we had an 87-year-old woman call our call center who hadn't gotten oral health, any care whatsoever since she was 11 years old, in tears, saying that for able to get that care, what it meant to her sense of purpose and dignity. Overall, these stories tell us that this is so much more than something we pass in Parliament or the numbers that we talk. This is people's lives. And it's a fundamental question about what kind of country we want to live in. And for me, that's why moving forward and ensuring every Canadian is covered is so essential. Because we've been talking about seniors, but there are so many folks out there who desperately need care, who haven't been able to access care, and it has catastrophic consequences. I was in Dalhousie and I was talking to Ryland. Ryland is a third-year student in dentistry with the director of the faculty there, whose name was Fern, who was talking about a young man, a young adult, who had an abscess in his mouth, who was in so much pain, bouncing from place to place, trying to find care. In so much pain, he turned to gargling gasoline to try to numb the pain in his mouth. This is what it means to not have care, to have stories like that. So today, we're so excited to say to families who have children 18 and under, and to persons with disabilities, that service is now here for you. You can apply today and be able to get the help your family needs. And to talk in practical terms about what that means, this means that a family who's having to make that choice about whether or not they pay groceries or they get the oral health care that's preventative for their family, they don't have to make that choice anymore. It means that a kid, as Pam is saying, who's walking around in pain that's ambient, doesn't even know that that pain is with them because it's been with them so long, can get the thing they thought was impossible for their family. See an oral health professional and get that pain taken away so they have the opportunity to focus on their studies, focus on being a kid. It means for a person with disabilities that where they often have such complex issues that the costs involved in getting oral health care are totally impossible to them. A barrier beyond even those that they've got to face every day just trying to get in and out of buildings, that now that's gone. Fundamentally, I believe this is about the country that we want to have. For Dan and Terry and I, This is not just a critical intervention in oral health, but it's a declaration that in our health system, taking care of everybody, making sure they get the care that they need is essential. It's why we're doing this. It's why we're doing what we're doing with diabetes medication or contraceptives. It's why we're doing the Aging with Dignity agreements that I was so excited to be here with Uzoma and the Manitoba government. With Terry, you were there. Dan, you were there on the Working Together agreement as well. Inclusively, it's saying we have one of the best health systems in the world, but we will not stop until we have the best health system in the world, and everybody's healthcare needs are seen, addressed, and taken care of. With that, I'm very excited to turn it over, I believe, to Dan, or am I going to? Back to Terry. Back to Terry. Well, I'm always happy to turn it back to Terry, who will continue us in the program.
Well, thank you, Mark, for that passionate address. Mark is so passionate about our healthcare system and making it better for all Canadians. Thank you for highlighting the progress we're making on the Canada Dental program. There's a new chapter being announced today for youth and people with disabilities, and this indeed is a good news day. And I am now pleased to call upon my friend and colleague, the Honourable Dan Vandal, the minister, as I mentioned before, responsible for Prairies Can. Dan was first elected as the Member of Parliament for Saint Boniface, Saint Vital in 2015. He is the Minister of Northern Affairs, Prairies Can and Can Nor, demonstrating his commitment to economic development here in the prairies and in our north. And throughout his career, Dan has been an advocate for Indigenous communities, the north, and communities across the prairies, especially here in Winnipeg. So please again join me in welcoming my friend and colleague and the representative for this area where we are standing, Saint Boniface, Saint Vital, Dan Vandal. Dan.
Thank you. Thank you so much, Terry. Mark Holland, bienvenue à Saint Boniface. C'est toujours un plaisir de t'accueillir ici. Today is a fantastic day for Canada. It's, of course, we're here in the Norwood region of Saint Boniface, and I want to welcome everyone. Terry mentioned my federal career. I was also a counselor for many years, and I had the pleasure to work with Pam for many years over at City Hall. So very happy to be here for this fantastic announcement, because this is about helping Canadians, because too many families are struggling to stretch their paychecks from day to day, from week to week. Et c'est pourquoi le soutien aux familles canadiennes est une des principales priorités pour notre gouvernement. Depuis 2015, nous soutenons la vie des enfants à toutes les étapes de leur vie, de la garderie aux soins dentaires et passant par l'acquisition de compétences. An important part of our government's goal is to create a country where people can access care and the support that they need. And oral health is an integral part of our overall health and well-being. And as Minister Holland has demonstrated, regular visits to the dentist reduce the risk of a whole host of other problems. And we couldn't do it without the dedicated oral health care providers who have already signed up to deliver care. And we know there's approximately 11,400 providers throughout Canada who offer a wide range of services. And we are witnessing a steady rise in provider participation each day. And I extend my heartfelt thank yous to all providers here in Manitoba, in Winnipeg, for their invaluable support, and to access and to enhance access to the program for eligible residents. Oral health providers will have 2 ways to participate in the program and deliver care to Canadians. Starting July 8th, oral health providers are able to provide care to clients either by signing up, as they have been able to do since March, or by seeing patients on a claim-by-claim basis, which is incredibly simple. Cela signifie que de plus en plus de personnes pourront recevoir des soins, plus de personnes âgées, plus d'adultes avec des handicaps et plus d'enfants. C'est le genre de pays dans lequel nous pouvons vivre d'une manière très fière. This is As Minister Holland has said, this is the greatest enhancements to healthcare in generations, and we're very proud to all be here to make this announcement, and we're looking forward to many positive conversations and positive effects of this policy going forward. Merci beaucoup. C'est un plaisir d'être ici. Thank you.
Well, thank you, Dan, for those important words. Thank you, Mark, again, for sharing both national and local perspectives on this important development in healthcare, in oral care. And now Chris Aoun is going to be, I think, leading the charge on Q&A of the ministers, and we'll leave it over to you.
Yep, thanks so much, everyone. Alors, on va commencer la période des questions. Vous avez une question, un suivi. Si vous avez une question, vous devez faire ici. When you ask your question, please make sure to identify who you're asking your question to and your outlet. Thanks.
Bonjour, Hugo Bocan de La Liberté. J'avais une question pour Monsieur Holland. J'aurais aimé savoir, donc ça a été mentionné, tous les professionnels de santé n'ont pas forcément rejoint le régime canadien de soins dentaires. Au niveau fédéral, comment est-ce qu'on fait pour en convaincre de plus en plus à le faire?
Oui, absolument. Merci beaucoup pour votre question. Et heureusement, presque 40% de professionnels pour le soin bucco-dentaire sont inscrits aujourd'hui. Et c'est un chiffre remarquable parce que juste dans presque 2 mois, un chiffre aussi haut que ça, c'est vraiment impressionnant. Mais on a beaucoup de travail de faire parce que c'est pas suffisant pour le domaine. Et ça, c'est évident. Et à Halifax, j'avais eu l'occasion de parler avec beaucoup de professionnels. Il y avait une sommet là. Et j'ai entendu que le nouveau date, le 8 juillet, est vraiment important parce que ça crée l'habilité pour le professionnel d'accéder au programme dans une autre façon. Il y a beaucoup de personnes qui ne veulent pas de participer officiellement dans le programme et ça va être possible de participer dans le programme une fois à l'autre. Et ça, c'est important, certainement. Et deuxièmement, je trouve que dans une région, quand il y a quelqu'un qui participe dans le programme, les personnes peuvent voir, oh, c'est vraiment facile, il y a beaucoup de bruit, il y a beaucoup de mauvaises informations, mais quand les personnes utilisent le programme, les personnes peuvent voir que le programme est vraiment efficace et vraiment facile et les personnes peuvent obtenir d'argent pour le service après juste normalement 12 heures. Et ça change les choses énormément parce que quand les personnes parlent avec toutes les autres professionnels qui utilisent le programme, et c'est évident que c'est aussi facile que ça augmente le nombre de personnes qui participent aussi.
Vous l'avez effleuré un petit peu, mais du coup, qu'est-ce que ça signifie en fait pour les professionnels des soins dentaires une fois qu'ils rejoignent le programme? Est-ce que ça a un impact sur leurs revenus? Qu'est-ce que ça change pour eux, je dirais?
Honnêtement, je comprends bien qu'il y avait des programmes provinciaux ou même si les programmes fédéraux dans le domaine de soins bucco-dentaires et le professionnel n'avait pas une bonne expérience avec ça. Et c'est vraiment une question de confiance. Et c'est avec la confiance, c'est essentiel chaque jour de travailler ensemble avec un esprit de coopération, de voir que, OK, c'est un autre programme et le programme fonctionne vraiment bien et le gouvernement est là de travailler avec les dentistes et avec tous les professionnels dans le programme. Et ça, c'est la chose qui est vraiment bonne avec le programme. Ça demande la coopération. C'est la seule façon qu'une professionnelle va participer dans le programme est volontairement. Et alors, tous les pouvoirs et avec le professionnel. Et ça crée un bon esprit de coopération. Et je pense que les personnes manquent de confiance à cause de mauvaises expériences avec les autres programmes. Mais de plus en plus, les personnes voient ce programme ici, le programme actuel, est vraiment quelque chose de différent.
Bonjour. Je vais commencer par le ministre Holland. Moi, c'est Gaël, dans Vol 91. Quelles seront les démarches pour le Canadien afin de bénéficier des services offerts par ce régime?
C'est un impact énorme pour les Canadiens partout au pays. Maintenant, aujourd'hui, il y a 9, moins que ça, mais au début du programme, avant le commencement du programme, il y avait 9 millions de personnes qui n'étaient pas capables d'accéder aux soins bucco-dentaires. Et ça crée des problèmes énormes pour la santé. Au début de notre programme de santé au Canada, il y avait une pensée où c'est juste quelque chose, pas vraiment important pour la santé, c'est vraiment pour le visage ou quelque chose de cosmétique. Mais ce n'est pas le cas, pas du tout. Les soins bucco-dentaires, c'est vraiment un aspect essentiel pour la santé généralement. Et alors, cette action aujourd'hui, l'habilité d'assurer que toutes les jeunesses partout au pays et les personnes qui sont handicapées peuvent accéder aux soins que les personnes ils ont besoin, c'est absolument essentiel pour eux.
J'ai une autre question pour le ministre Vandal.
Oui.
Pourquoi le choix de Saint Boniface pour l'annonce de cet investissement?
Bien, bonne question. Je crois on sait que cet office ici, c'est un nouveau style de donner des services aux jeunes. Puis on pensait que c'était très accessible, puis c'était une bonne façon de promouvoir le programme avec les jeunes. Parce que ce élargissement de programme vise les jeunes moins que 18, puis les personnes handicapées. Puis le fit est vraiment bon avec l'office de Huddle. Puis ici à Saint Boniface, c'est même mieux.
Et pourquoi ce moment ici?
Pourquoi ce moment ici? Parce qu'on s'est engagé, ça fait une couple d'années, que le programme va donner des bénéfices à tous les Canadiens à faible revenu, moins de 90 000 par année, je pense. Puis on élargit le programme, le critère du programme. C'est le temps.
Okay, if there's no other questions in the room, oh, you can just come to the mic over here, please.
It's for Minister Holland, so I'm gonna, if you can just step up to the podium so I can just make sure.
Maybe just, I can repeat the question because that's helpful. So just so that folks who may perhaps are online, I think as Chris is concerned, can hear the question. So I'll do an abbreviated version. I promise to do a good job. So I'll abbreviate your question.
So, Minister Holland, can you respond to members of the Canadian Dental Association who say government communication about the program has been confusing and frustrating for many patients?
Well, we've been having really positive conversations over the last year with the dental associations, and I had an opportunity to meet with many of the people in dental associations just when I was at the Oral Health Summit in Nova Scotia at the end of last week. I think it's actually very clear. And I think in fairness to them, and I said this to an earlier question, I didn't paraphrase the question, I blew that. So let me go back and say what the question was. The question effectively is, look, we have a lot of dental associations that are saying that the program needs to be more clear and that they want information that's more direct or I don't, I get that there's continued issues. I would say that a lot of those concerns come from having been burned from other processes. I had a really wonderful conversation in Nova Scotia with somebody who used to be on a dental association who said, look, Mark, this program is great, but let's be straight. What's happened in the past is governments come in with a program and it sounds great and wonderful at the beginning, but later on they pull the rug out from under us and we're left with vulnerable patients without proper support. And I get that. And I think actually, that's at the core of a lot of these concerns because, you've heard me talk at a microphone before. I'm trying to figure it out too. And I think that there is, sometimes there isn't a lot of trust because, frankly, their profession hasn't always been treated fairly. And so I'm here, what I said to that very thoughtful person was, look, you're not going to find a better champion than Dan, Terry, myself, and our caucus. This is an opportunity of a lifetime to advance oral health care. And I think it's a fundamentally different moment for Canadians. I don't think, when we're talking a year from now, and instead of 200,000 people, we're talking about millions of people who've received oral health care. I think it's going to change this country permanently. I don't think that there's any political party that's going to come to a microphone and say they're going to take that away. Because when you talk to somebody like Pam about what this means to people's lives, it is so essential. And what I would say to them is, I was the head of a not-for-profit, and, my job was to advocate. And whoever's aligned with your mission, run with them. And when they're not aligned with your mission, go find a person who's more aligned with your mission. We can't operate from a place of fear, even though we've been burned before, and all of us as human beings have. But, this is a moment that has to be seized for this country. And so there is a bit of a leap of faith. But part of what I'm understanding now is that slow roll is, yes, there's a lot of noise and there's a lot of people filling them with fear. And I've spoken from a place of frustration about how angry I am about people filling them with fear. But they have a reason to be afraid because they haven't been well treated. And so we're building trust. And I think what you're seeing every time I come to a microphone, the number of providers is growing. It's getting bigger every day. And that's because, again, Dan, Terry, and I, and the rest of our caucus, we're talking with them every day. We're making improvements every day. We're demonstrating that we care about them. We don't just care about oral health as they do. And by the way, it was their associations that recommended this model in the Romano report in 2001. We care about them as providers. It's not fair that we weaponize their goodwill against them. They take on these patients, and then the supports are pulled out. What are they supposed to do with these patients? So, it's essential that we are there for them, and that, frankly, I would say to all political parties, this is not something we should cross swords on. Whether or not a lady has dentures in her mouth, I tell this story often because it just sits in my heart. It's like one of those things that just stays with you. But I was talking to in Vanier. There's a denturist talking about a woman it's had the same pair of dentures 41 years, plastic plates in her mouth. The only way she could eat food was to crush it with these plates. And then she gets a new pair of teeth in her mouth. What are we talking about? This is Canada. This is a debate. That woman has teeth in her mouth is a debate in this country. And so I think that the dentists and the denturists and the hygienists all deserve to knock out all this political nonsense and say, yeah, these people deserve care. It's that simple.
Okay, thanks everyone. We'll go now to Zoom for questions online. I'll hand it over to the moderator online.
Thank you. We'll now proceed to questions from journalists on Zoom. If you are a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and the media outlet you represent before asking your question. Nous allons maintenant prendre les questions des journalistes sur Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Sauf si je l'ai indiqué, veuillez identifier votre nom et votre média avant de poser votre question. La première question provient de Laura Osman from the Canadian Press. Laura, over to you.
Hey, Minister, can you hear me all right?
Hear you clearly.
Very good. I wanted to start by asking you how this program is going to interact with provincial programs, particularly for people who have disabilities and just don't understand how this is going to work.
Yeah, Laura, that's a great question. So, we're coordinating these benefits with provinces and territories to make sure that that is a seamless experience, and to make sure that the base principle of this program, which is so important, is that it's based on medical need. So there's no cap for an individual, and for persons with disabilities, that's a really big deal, because oftentimes, as you alluded to in your question, Laura, there are people who have very complex oral health issues. They're already dealing with huge challenges being a person with disabilities. And so there's a couple of different aspects of that. One, to make sure we're working with provinces to coordinate care. Two, to make sure that that we, adhere to that coverage of everything that's medically necessary without a cap. And then in the third order, working with the associations and with providers, because a lot of denturists, hygienists, and dentists have never seen patients who have disabilities. So this oral health access fund, I think, is going to be really important on that front as well.
Thank you. I spoke to some disability advocates who have expressed to me that they feel that expanding this service to people with disabilities now is a little bit of lip service, given that they don't know how it works with provincial programs. The complex medical needs that require pre-authorization are going to be dealt with till later. And, essentially their efforts by the government to lift people out of poverty have not sort of delivered on their expectations. And so they're feeling a little bit discouraged, even as you're expanding eligibility today to them for this program. And I'm wondering what your response is to those folks.
Well, I think I hear them. And, one of the things that we know in this country is that progress is hard won, each step at a time. We have 9 million people who don't have oral health care. It's the largest program in Canadian history. Rolling it out to everybody is a big deal. And every person that gets care that didn't get care before is victory. But it doesn't mean there's not more ahead of us. We have 183,000 folks when we're talking about persons with disability who are now eligible. Now, the reason we have the Oral Health Access Fund is we recognize that just that act of making the service available in and of itself isn't enough. And that, we're going to be able to punch into that number, but not as far as we would like. I would say, and this is, I say this a lot, that I'm an incrementalist. I know, and I've seen from all the experience of history, the way you make progress is 1 inch at a time. And people say, well, that's not very exciting. Incremental progress, I got to wait around when something's unjust or unfair. And I say, okay, well, then let's call it radical incrementalism. We'll move as fast as we possibly can. What people deserve to see is that every day things are getting better. And what you're seeing now is, for persons with disability, they have hope. They were lost in the shadows, forgotten, not talked about. Now they're saying, we brought in this national benefit, which is putting $200 a month into the pockets of people who are in really tough situations, and they're saying that's enough. Now we're saying we're expanding dental care for persons with disability, and it's not enough. And they're right, but it's a different conversation, isn't it? Because they're talking about more. And they're getting hopeful, and they're saying, we can do this, we can change this. That's a different energy. The energy that we have from the Conservatives is, well, give up. You can't believe in any of that stuff. They try to say it's fantasy. This is what they said about dental care. It's never going to happen. No one's going to get service. Because the way that they get people to stop believing and hoping is to say that it's impossible. And I wish I had a magic wand. If Terry and Dan and I had a magic wand to fix these problems, we'd wave it in a second. That's where our hearts are. But the only way we can change it and make it better for people is that inch by inch, hard fought bit of progress at a time. And that doesn't mean that persons with disabilities, or any person who's suffering, should accept their position, but they should choose their champions. And their champions are people that tell them it can get done, improve it, and progress every day.
Thank you, Minister. The next question is from David Turton from CBC. David?
Yes, Minister Vandal. Can I ask you this question? It's about the Toronto-St. Paul's by-election. What does the results say about Prime Minister Justin Trudeau's future?
Well, first of all, we're all very disappointed with the result of the by-election. Leslie Church is a wonderful candidate and will one day make a fantastic member of Parliament. I think we have more work to do. Everyone in caucus has a lot more work to do with listening to Canadians, constituents, including the Prime Minister, and I think he's already said that. I think I think I speak for Manitoba caucus that we are 100% supportive of the Prime Minister going forward as our leader.
Aside from working harder, what needs to change?
I think as the election becomes closer, Canadians are going to ask themselves the hard question: what sort of Canada do Canadians want to live in? Do they want to live in a Canada where dental care for kids is a real thing. And I remember the leader of the opposition was on French TV about a month ago, and he was asked if he's going to keep dental care. And he said, it doesn't exist. It's a non-existent program. Well, I can say under the first tranche of dental care in Manitoba, it helped 28,000 kids under 12. That is incredibly significant. That is real. And that's just one example of Canadians are going to have to answer the question, what sort of Canada do we want to live in?
Thank you. The next question is from Colin Slark with the Brendan Sun.
Good morning. I was wondering, I know this is more of a Manitoba specific question, but do you have an estimate of how many people in Manitoba might be able to benefit from this program with the expansion?
28,000 have already.
Yeah, I mean, so Dan mentioned 28,000 kids that already benefit under the previous program and this plan that we're announcing today. So I will get back to you, Colin, with the exact number for Manitoba. I don't have it on hand, and I apologize. I should, but I didn't have it on hand. But we'll get that back to you with the exact number. It's going to be a lot of folks, but we'll get you the exact number.
Thank you. Follow-up question. What work is going on to continue to recruit more dentists to make the services in this plan more available to people across the country?
Sure. Well, that's a great question, Colin. You know, I've been to 3 out of the 10 dental colleges in this country, and they're doing phenomenal work. I'll be going to, I was just in Dalhousie, I'll be going to U of T in the next couple of weeks. And it's wonderful to hear dental students so excited. You know, one of the things dental students get to do is to see vulnerable patients, right? The people who come into dental colleges are folks who don't otherwise have care. And that was the case before this program existed. And so they really get to connect with the heart of what their profession is about, serving people who really are in need. And so I'm hearing from those colleges, like they have no problem attracting patients. There's all kinds of people who want to enter dentistry. When I'm talking to the hygienist, it's the same thing when I'm talking to the denturists. This program, you know, one of the things that I say, because there's major health workforce issues in oral health, but knowing now that if you're going to enter this profession, you have a guaranteed book of business. Like normally with a dentist, it take about 14 years to build a book of business. A lot of people saying, well, I'm not sure I want to go into that. Similar thing for a hygienist or for a denturist. Now you got it in about 14 seconds. That's a big deal. The second thing for rural and remote communities, and I think it's appropriate that we talk about that because some of our greatest needs sometimes are outside of urban areas. The loan forgiveness program that says to somebody who chooses a profession in healthcare that we're going to help you by giving loan forgiveness is absolutely massive. And so when a lot of those students I'm talking to suddenly are very interested in going to more rural or remote communities. So I think the program, the loan forgiveness, and the partnership with the incredible colleges that we have across this country are going to transform the space. And the great news is there was a shortage before this program began. Like this was an area that really needed focus. Now they got a partner.
Thank you. The next question is from David Akin with Global News. La prochaine question est avec David Akin de Global News.
Unmute, and there we go. Good morning, ministers. Good morning, Terry. I take note that this is one of 6 events, maybe more across the country, where ministers are talking about this program or are essentially replicating the announcement you're making. And I'm wondering that, you know, given the results on Monday, that this sort of PR push to talk about this key program of your government is an attempt by your government to earn some political reward that has not yet perhaps been forthcoming from Canadians to get some credit for, as you both have said, Minister Vandal and Mr. Holland, you know, the greatest expansion of healthcare in a generation. Canadians don't seem to be noticing, but should you be getting some political credit for this tremendous expansion, Minister Holland?
Well, David, I just don't wake up in the morning and think that way. You know, when I woke up this morning, I was thinking about the people that Pam serves every day and their needs. And, you know, one of the things that I learned in this business is that you know, if you focus on the moment and what your relative political advantage might be from moment to moment, then you're missing the point. I was given the incredible fortune of being elected, and then the Prime Minister gave me the incredible fortune of being the Minister of Health. And I think what my job is to do is to wake up every day and do my best. You know, there were other questions about, well, what could you do better? And I do think about that. I think this is a call to do better. Watching the Conservatives win in St. Paul means that like everything we're working on could be thrown in a trash bin. And that doesn't worry me because I'm a Liberal. That worries me because I'm a Canadian. And I think that the things that they would throw in the trash bin would really set back our country. And so, you know, I think all you can do in life is show up and work with the best of your heart and intention for the people that you care about and that you serve. And in this instance, we're fortunate enough to serve an entire country, and a country that we love deeply. And, you know, at the end of the day, 16 months from now, people will evaluate rightfully whether or not we did a good enough job and whether or not somebody has a better vision. But I think that what we have to do, and, you know, we keep talking about hard work, and people say, well, you got to, maybe you got to do something else. Like, there's no tricking people. Like, there isn't no, you know, there's some kind of like message that we can put out there that's going to magically change things. People have to see who we are and what we're doing. And then they have to ask the question whether or not it's good enough. But all of this fixation with hypotheticals, like you know, and I get it, I understand, like it's really interesting for people to read about, but like, I just don't think it's where people are at. I don't think people want to talk about hypothetically 16 months from now, what government might be there. They're like, I'm hurting now. I need service now. I don't have care now. What are you doing? And if I'm spending my time and we're spending our time worried about the politics of it, then frankly, we were elected to do a job and we're not doing it. There'll be an election in 16 months. At that time, there'll be an opportunity to have these political conversations about who's right to lead the country. But we were duly elected, and we have a 4-year term to get the job done. And, you know, I don't think in the middle of a project is the time when you stop and you make a decision whether or not you throw it out. You know, we were given an assignment. We're going to carry it through. To your question very specifically, David, about, you know, are we trying to coordinate more? Yeah. I mean, I think one of the challenges of being a government, which is focused on doing things, whether being an opposition, which is Googling problems and saying them into a microphone, is that you're doing a lot of things, you know, and so doing all of those things, sometimes you don't think about, you know, how well you're communicating it, or, you know, can we coordinate it, because we want to get things done. We're running around trying to improve things. So yeah, we do have to be more coordinated, and so we'll try at that. But I think fundamentally what it comes down to is Canadians are smart, intelligent people, and when it comes time to ask what kind of country they have, we're going to be putting a very solid case that the things that we've done need to be continued.
Thank you very much. I will point out, just for the record, it was not hypothetical for 40,000 people in Toronto St. Paul's on Monday. They did actually make a decision. But here's my second question, and this is about Alberta. I just wondered if you could react to Premier Smith's decision that she wants to pull out of this program by 2026.
So let me take the first part of what you said, because you're right. People in St. Paul's made a decision, and we're responding to that. But I think that people in St. Paul's knew they weren't changing a government. They were saying, we're upset at the world right now. I knocked on those doors. I didn't hear anybody saying, I love Pierre Poilievre's plan for the country, because he doesn't have one. You know, he's reflected the anger that exists in the world. Well done. You know, where are people happy in the world right now? It's a tough time to be alive as a human being. And, you know, so that was about frustration of being able to express it without changing governments. And I understand that. And that message is heard loud and clear. And for Terry, Dan, and I, like, yeah, we're going to dig deeper. I'm going to wake up in the morning and try to work harder and try to do more and try to meet the frustrations of those people with better effort and clearer communication. But, you know, I don't think saying that they made a decision about the kind of country or government they want is at all accurate. In terms of Alberta in 2026, look, I just care if people get dental care. It's really simple. And, you know, I was a little frustrated yesterday because you kind of see the ticker tape of things going on television, you know, Alberta to pull out of the dental care plan. Well, that's not what's happening. What's being talked about is whether or not the federal government administers it or the provincial government administers it. Now, if you're a family and your kid needs oral health care, what do you care if it's Alberta or it's the federal government? Like that kid that I was talking about, like he wasn't a kid, he's 23 years old, but he's a young man gargling with gasoline, isn't thinking, boy, geez, I hope that it's not the government of Nova Scotia administering this. I really hope that when I go in, that it's going to be, no, like, what are we doing here? Okay, Alberta's saying they want to manage it. If you want to manage it, then we have clear conditions of what it takes. At a baseline, it's got to be at least as good as our program. Number two, we're not going to give you more money than it costs us to administer the program. And number three, we need an assurance, just like I was talking about dental providers earlier, that you're not going to burn providers later on and defund this program and not implement it properly. So, if you want to have that conversation, sure. But it seems the way that Premier Smith put it, it was more about trying to seek conflict with us to create some kind of political thing than it was about patients. So if it's about patients and it's about care and they think they can do better, great. But here's the news. They weren't covering these people. If it's their jurisdiction, then with all due respect, you weren't doing your job. And so we're stepping in and we're doing the job. Now, if you suddenly have decided it is your job and these people who are uninsured and don't have coverage deserve coverage, fantastic. Great news. Let's sit at the table and talk about how you're going to make it better. I want to have that conversation. But just having a conversation about jurisdiction for jurisdiction's sake, I mean, that's just nonsense.
Thank you. This concludes today's event. Ceci conclut l'événement d'aujourd'hui. Merci à tous.
Great work. Thanks so much.